All right, good afternoon. We're going to talk about the paperwork section of the integration seminar. The first piece of paper document that you should have looked at already, if you haven't, is going to be this one that tells you a little bit about what the disorders or diseases are that we're going to be covering in this section. So, as you've heard already, the content that we cover is not going to be anything new. All of the content that's listed here is things that you've had already in your curriculum. Um, you're going to see a variety from every system. You'll see some psych stuff and some um, every system that you've covered and up until now. You'll have skills that you'll need to do. You'll take care of patients with falls and blood administration. Alternative therapies will be integrated in to take care of a variety of things. And not every rotation will take care of exactly the same things, but these are the things of the topics that the patients will be coming in with that you'll have to take care of. There will be some disease processes that you might not have really gotten to yet, like ostomy care that we haven't really talked a whole lot about, portacath accessing, chest tubes, you haven't gotten to deal with those a lot. You haven't done a lot with blood administration. Some of those things, especially like ostomy care and um, bucks traction, those kind of things that you don't know that much about, those are skills that you would have in the last week of clinical that final performance. So you will have had a couple weeks to prepare for. So if you haven't looked at this document, please take a look at it now. It's an important one for you to see. The next is the schedule that we're going to look at. Uh, the information on the schedule is listed up here again. Miss Aber and my office numbers and phone numbers and things like that, and you'll be able to look at them and get in contact with us. If you look at the schedule, it's pretty much just a guide to help you as far as what your day is going to go. The biggest thing on here that I want you to see is that your lunch is going to be a very short lunch a lot of the days. We encourage you to bring your lunches or eat very close to campus, such as Wendy's, if you can get in and out of the Pentecostal Center quick, but Sonic, Subway, somewhere right here that you can walk in and out. CC's is quick. So your 40 minutes does not give you a lot of time. So be prepared for those days where you don't have a long lunch, and that's going to be most of your days. You're going to see that in the morning time we're set up with our NCLEX questions and assessment, group discussions, and then in the afternoons, most of the afternoons we do our role play. There's a section on here as well that tells you what your responsibilities are at the end of the day as far as helping clean up the lab. Days 2 and 3 will be the same. This will be Wednesday of week 1 and Tuesday of week 2. And this group, or you'll see that if we have different number of RNs for different roles, how the schedule would have to change to accommodate. But in general, this should give you an idea of how the day will go. We will not stick exactly to the schedule, I'm going to tell you. Never in my experience have we been right on schedule. But this is a guide. And so you can see that you need to plan on being here and starting at 8, and you need to plan on being here until 4. Okay, every day. Very unlikely that we get off too early. On day 4, you'll note that we'll be doing a role play in the morning section, and then you will be allotted 3 hours in the afternoon to work on your group work. You have to be in the lab on the second floor, or we may allow you to go to the LRC, but if we do that, you have to be available. If I send a text to you, or if I come down there to meet with you, you have to be able to be immediately available to the faculty, so you won't be able to leave campus, and you have to be able to respond and come back as needed. The thing with this day, especially if these 3 hours, if you're caught in the LRC working on other content or doing NCLEX questions for 425, that is an automatic unsatisfactory for the day because you're not using your clinical day as you should. And if you were already on a contract, say for professionalism for the same thing, that would be a failure for this rotation. If it was your first offense in that, then it would be a contract initiated. But this is not recommended, and you would ruin it for the rest of the semester of the classes. Everybody would be required at that point to remain in the lab on the second floor and work in your group work. Carrying on down the schedule, you'll see that day 5, there's no role play. This is the Tuesday prior to the final day. Again, the schedule is tentative, pending if any closures for the university or anything like that. Of course, the schedule would change, but as it stands right now, this is our tentative plan. You'll do mostly, class kind of group work with me, discussion cases, math activity, awareness activity, and so forth. Be no role play on this day. And then Wednesday would be your final performance. Now, again, this is a guide. We have to adjust the schedule based on the number of students. This was based on having 6 students or 7 students, and some rotations will have 5 students. And so the schedule and the times will be adjusted accordingly per rotation. But the schedule should help you. It is a guide as to what you're going to be doing each day. So what is your schedule going to be like? You guys will have something posted. This is just an example. You'll have a specific role play assignment posted, and your name will be listed over here where it says 1, 2, 3, 4. It'll say like Joe, Bob, Sue, and Jen. And then that would be if you're number 1 up here. That means on the first day, which is the very first day of clinical orientation, that afternoon, this person would be RN1 for the first portion, and then during RN2's role, they would be the reviewer. And RN2 will be the reviewer, and then RN2. And on this day, for example, they would be the reviewer during RN3. So this would be like reviewer during RN1. It's a typo here. I apologize. It should say reviewer right here, and then RN3. So we would have 3 RNs for the day and a charge nurse. We'd have a patient and a family member. And then this would be day 2 on the Wednesday, day 3 and 4 as follows. You'll see on a few of these days where it says like this one right here, charge nurse 1. That means we would have 2 charge nurses that day if that's the case. And charge nurse 1 would be for the first 2 RNs, and charge nurse 2 would be for the second 2 RNs. But that is kind of how you would read your schedule. So be looking on Moodle site for each rotation is going to be a little different based on the number of students we have. So look for your rotations number and look at your schedule. And if there's any kind of questions or concerns, contact me. I'm Miss Doherty. You can contact me at ldoherty.mcneese.edu. Okay. So that is, and then your final day is day 6. You'll have something that'll look like this, and where it says so whoever's names are on number 1 and number 4 would be the group in this one. 2 and 3 would be paired together, and 5 and 6 would be paired together. So in this rotation, there would be 3 final performance cases on the last day. The rest of them are blank because we'll fill that in as we go. We may make some of you a patient again, or a family member, charge nurse, whatever we need for the case. So that one's open right now. Lastly, oops, let's get out of here. Let's talk about some of your evaluations documents. You have the student. This is the document that you'll be doing every day and emailing back to us, or bringing it back to us as instructed. But this is something we want you to document on every day. We want you to be very thorough. I want this typed up. I want it very long. I want to know exactly what you did to help out, what you did right, what you did wrong, what did you learn, what information was unclear, is there anything I need to clear up for you or the group as a whole. And you'll see on here that the form will be submitted electronically by 8 a.m. the next morning. Okay. Each day, the faculty will also do an evaluation form on each student. This is also available to you, so I encourage you to look at it. There's nothing that you need to do on this. This is just basically after the day I go home and I reflect on your performance individually, and I will give you a rating of 1 through 4, and then this kind of tells you what those ratings mean. I do my best to, give you some explanation as to why you received a 2 for the day. It may have been that, you did everything that you were supposed to do and everything went great, but you need some improvement. Maybe it was because in your role play you, left the bed up and didn't wash your hands when you left the room. That would be 2 unsafe events. Something simple as that could put you at a 2. Okay, you did everything else that day, it was good, but you had 2 unsafe practices during your role play. Well, that means you need some improvement, and you'll get a score of a 2. If the second time you receive a 2 or a 1, the contract will be initiated on the second day that you received a 2 or less. Okay, if in fact you receive a 1, then that's an automatic contract to be initiated. Now, we'll discuss this a little bit further during your orientation on the first day, and kind of give you some feedback as to things that would get you a 1. But you can kind of read this, and then on the second page, this is just a guide for the faculty to kind of make, and for you guys to know what some of the roles are and what your expectations are. So we use this for every student, and we look at, think if you're the family member of the patient, did you do these behaviors and demonstrate knowledge of the condition? Did you ask questions like we asked you to? Did you exhibit the right signs and symptoms, or did you demonstrate emotions that were appropriate for the situation, and so forth? And charge nurse, again, we want you guys to take charge and be a leader. We want you to perform safely with confidence, or use an appropriate tone and terminology when you discuss and educate your patients. Clinical evaluation form, that's what this looks like. I'm not going to go through the entire form with you, but you need to read through the form and be aware of all of your expectations. Reviewer's notes, this is what it looks like if you haven't already looked at it. You're going to need, I would suggest that you printed this as a 2-page, so this would be the front page and this would be the second page, and you'll have if you do that, this document has it where there will be 3 RNs to be covered on this one time you print it. So print it front and back. This is where you'll keep notes when you're the reviewer. Get familiar with the document before the first day so that you'll know what you're doing. And the rubric, this we will talk about more in detail, but again, you need to read over it. It is the rubric that you will follow to do your submission for the final performance case that you guys as a group will come up with. I will give you a topic or a basic generic scenario of information, and you will take that and divide the topics, do the research, come up with how you think it would be the best way to care for a patient with the given disorders or conditions. And then you have to do a PowerPoint and submit all your information, your research and documentation. And then it says day 5, but we've changed it to day 6. So just in case you see that, you will be either RN 1 or 2. I will tell you that like the day of. You won't know until you show up. So you'll be given a report from the faculty. We'll kind of proceed through it as we have in role play in the previous weeks. And again, you can read through this, but you both want to understand everything individually. Like you can divide up the work, but you need to read over your partner's work, and you need to understand, because you don't know which role you're going to take, and you may be the one having to do all the education or explanation of the drugs that your partner looked up, or that the skill that is new, the ostomy care. You both need to know that, or the Foley care and specific things to that patient and why we're doing what we're doing, wound cultures, or whatever the orders were that you were given. Everybody in the group needs to know how to do it, because you don't know what role you're going to take on until you get report. the case that you guys submit to me is not the case that you're going to be turned around and given back to perform. That is simply a proof that you have put the research together and shown that you know the correct way to do things and that you have brought it all together in the form of a case scenario. So I will go a little bit more over that, but this rubric, if you read it in detail, gives you exactly what you need to do in order to be successful. Sorry. A good idea is to use or take these questions and make them your own, and use these as headings on your PowerPoint slides and add your own creativity into that. And you would answer all these questions. You would provide the answers or the rationales or whatever on the notes section of the PowerPoint. And we will cover this, like I said, we'll go over it more in detail on orientation day, but look over it so you can jot some questions down prior to that day. In order of the day, again, we've kind of already shown you that we'll do NCLEX questions, math activity, group discussions, and so forth. One thing that you haven't seen yet is a quick reference med sheet. And I'm not going to go through this, but this is something that we have in the lab for you guys. And it'll be printed up and it'll be readily available. And so if at any time you're given a medication and you don't know what it is, I've taken liberty of typing up the majority of the meds that we're going to be using, and it will be here. And so like if you needed to give Norvasc, you have all the information on here that you need. So you need to be able to explain, if you're asked, or even to the patient, I'm giving you this medication. It was ordered by the physician. It's Norvasc. It's a calcium channel blocker. It's going to help lower your blood pressure. It shouldn't have any effect on your heart rate, but you might get some, flushed skin, and you might cause some dizziness. So I need you to get up slowly. And you need to know things like, if I give you vital signs and the blood pressure is 85, then you would hold this and notify the physician. You don't necessarily have to tell the patient that, but that would be an implication for you to follow. So again, this is not something that you have access to right now, but it is available as a drug book reference guide for you in the lab, and you'll see that there's quite a bit of information that you need and quite a bit of medications. So that is something that you will have available to you. And your MAR will have that provided for you too, in case y'all need that. But if you have any other questions, that is the paperwork and documents that you need to be familiar with for integration seminar.